Veterinary medicine is a messy business, both physically and emotionally. Vetsplaining is one veterinarian's attempt to explain and understand her own profession a little better. Join Dr. Lisa McFaddin as she delves deep into the medical and business aspects of veterinary medicine.
Welcome back. We are going to try a new segment. I'm going to call this Vet Life Hacks. And I'll start with this initial podcast, and then depending on the response, we might do some more. But there's a lot of information that veterinarians have that seem like common sense to us because we went to school for a long time and we see pets day in, day out, and we treat them day in, day out. But they're not things that owners necessarily have ever thought of or should be expected to have thought of. And I think sometimes there's a breakdown in communication between the veterinarians and the clients, and a lot of that revolves around what we think is common sense or baseline knowledge. So my thought was, if I do a podcast about, all right, these are things we know that you guys may not know that I think will make your life a little bit easier, I hope that it comes out with the unintended meaning of this is for your information. The purpose of this is not to sound like I'm lecturing owners, because I say it every day. You know your pet way better than I do, right? I see your pet a few times a year. If they have a chronic disease, a few more than a few times a year, or if they need chronic acupuncture fairly regularly. But you know your pet best, and you know what is best for your pet. But as a veterinarian, there are certain things I've picked up along the way, just like parents pick up tidbits and human doctors pick up tidbits. So I divided this into a couple of sections, so we'll just run through some of, again, I'm going to call these vet life hacks. So first and foremost, don't hesitate to call us. If you have a question, if you're concerned, we are concerned, okay? We can't help you if we don't know what the problem is. So if you're not sure if it needs to be an appointment, call. If you're not sure if it's an emergency, call. And our customer service representatives, CSRs, or receptionists, can frequently get a lot of good background information. They may or may not be able to answer your question as far as whether or not your pet needs to be seen. They can also ask the doctor or a licensed technician. So if you're concerned, please call us. Along those lines, everybody always, including myself, uses Dr. Google. He's not a real doctor. There's a lot of useful information on Google, don't get me wrong, and like I said, I use it fairly frequently for myself or for my kid, but you got to take some of that information with a grain of salt. And if you read something on the internet and you're not sure if it's true, ask us. Again, I'd rather have a million questions and have that pet's life have better quality and have my client's day be easier than you guys do something that might be harmful or you're not sure if it's right. So bottom line, ask us. Along the lines of Dr. Google fall in that category breeders and pet food employees. They have a lot of information. Like breeders, they know their breed, they know their line, they know their pets really, really well. And a lot of them have very, very good concrete evidence and concrete information. But there are some recommendations that breeders make that I don't necessarily agree with. And I think that, for instance, a lot of breeders of certain breeds, especially it's a trend around here, like the little golden doodles, they say, never get a lepto vaccine. Well, your pet may or may not need the leptospirosis vaccine, but that is a conversation you should have with your veterinarian. That's not medical advice that should be given by the breeder. Even if the breeder's a veterinarian. I mean, if the breeder's a veterinarian in, let's say, Arkansas, and you're purchasing the pet and you live in West Virginia, well, there's two totally different climates. And so it still behooves the client to have that conversation with the owner and not necessarily to take everything that breeder says as mandate. And the same can be said to, sometimes we give our medical opinion and you may not agree with it, but have that conversation because we can't find a solution if we don't have a conversation. Another example of that is cottage cheese. I've had quite a few people tell me that their breeders recommend cottage cheese for their pets to get their ears stand up. There's no real I don't know the pathophysiology behind that because, sure, there's calcium in cottage cheese, but your ears aren't bone, they're cartilage. And a lot of pets are actually lactose intolerant, which is why it is weird that humans are, the only species that drink milk past infancy. So a lot of times it'll give the puppies diarrhea, and it's really not going to get the ears to raise up. And I know, I'm sure some people will be listening and be like, I swear by cottage cheese. I think it's really just coincidence that like you started feeding it around the time that the ears were going to go up, but there's no, again, it's cartilage. There's no real reason that should make the ears go up. The next so that fits under the category of like why we're here, right? So life hack number 1, why veterinarians are here. We're here to help you. And the only way we can help you is if we talk. And so that means pick up the phone, schedule an appointment. Life hack or veterinary life hack number 2, I guess, would be human versus animal medicine. They're not the same thing. And I know that sounds really obvious, and I don't mean it to sound condescending. Although my favorite, I had this mug and a t-shirt in vet school that said, real doctors treat more than one species. It was like my favorite thing ever. And there is some animosity between human medicine doctors and veterinary medicine doctors. And it's interesting because if I go to the doctor and the doctor asks what I do and I say that I'm a veterinarian, their initial response is always, man, it's really hard to get into vet school. And part of that is because there's a lot less veterinary schools in the country than there are compared to like medical schools or doctor of osteopathy or DO schools. But then, so they'll say, oh, it's really hard to get into vet school. You must be really smart. And then when I ask questions, they kind of play it down, or they sometimes act like my suggestions or concerns aren't really valid. So it's interesting because apparently it takes a lot of smarts to get into vet school, but like not a lot of smarts to be a patient and ask questions. But anyway, that is not the type of camaraderie that we're looking for. However, there are huge differences between human medicine and animal medicine. And I have learned that so much over the last 2.5 years since I had my child, because there's so many things that I'll call the pediatrician's office about and say, oh my God, this happened, because it's like a bigger deal in veterinary medicine. Or those signs mean something else in veterinary medicine, and it's really not a big deal. And the vice versa is true, right? There's certain things that can happen to your kid that you're like, that's not a big deal, but it is. And, so signs and symptoms seen in people are not always signs and symptoms seen in animals. And both practices of medicine deserve equal respect, right? Like nurses deserve respect, doctors, human and veterinary, licensed technicians deserve respect. So my veterinary life hack 2 is there are 2 different types of medicine, but they are both valid and they both deserve our respect. Vet life hack number 3 is appointment preparation. So there's some things that I think that clients can do to help prepare for the appointment that'll make it a lot smoother and a little bit easier for them, for their pet, and for the veterinarian. So first, don't use shock collars, prong collars, or retractable leashes at the veterinary hospital. Prong collars and shock collars, like, we're not going to get into the discussion of whether or not they're good to use or whether or not they're helpful or harmful, but they're the part of the mechanism of action is they trigger a pain response, right? So it's supposed to get their attention. Well, dogs are like super keyed up most of the time when they go to the veterinary hospital, whether they're happy to be there or not. And so their sympathetic nervous system is in overdrive, and so they're not going to respond to that cue like they normally do. And frequently what happens, especially with shock collars, and people will come in with like the trigger worn around their neck, and they'll just like keep pressing the button because the dog's doing a behavior that they're not supposed to do. That's not reinforcing the training. It's just stressing them out more. And the same thing with the prong collars, like it's not going to get their attention like you think it is. And if we need to do a blood draw from the neck, so from the jugular vein, they get in the way, and like sometimes they're really hard to get on and off, and they're confusing. So just don't bring them to the hospital. Or if they have a shock collar on, just don't bring the remote for it. Retractable leashes, so I'm going to be 100% honest. I have a beagle mix, right? And so his nose is to the ground 24/7. And I did a terrible job training him to walk on the leash, mostly because I had just finished vet school and I was an intern and I didn't have any time. And then I felt guilty about not having any time. So I was like, whatever, you can walk wherever you want when you're on the leash. So I have a retractable leash, right? And so we go outside and we go for these, like, I walk in a straight line. He like zigzags and cuts back and forth, and it's my own fault. Like, totally admit that I should have trained him. But I made the mistake, I think, once or twice of, if I had to bring him to work, bringing him with a retractable leash. And like, they're not as strong, and you don't have as good of a control. And the like stopper mechanism, if they pull hard enough, like if you yank back, they can let go, and then they can run off, or they get tangled really easily, or you drop it. And there was a pretty interesting article a while ago about how traumatic retractable leashes can be for dogs, because like if it gets dropped, all of a sudden there's this like loud noise, right? And then this thing is just like chasing them, and then they are trying to run away from it, and it's following them because the leash is trying to do its job and retract, and the dog is like, get away from me, get away from me. They're like running away. So retractable leashes, again, whether you are pro or not, they really are just not super helpful at the vet hospital. And a lot of times if people bring dogs with retractable leashes, we'll have to take them off and then put on one of our own little slip leashes, just because we have better control. If you're going to the clinic for a specific medical issue, right? So urinary, fecal, skin, ears, we need samples in order to test. So like if it's a pee issue, okay, whether it's a cat or whether it's a dog, cats are a little bit harder. Don't let them pee like right before they get to the clinic, because then we can't get a urine sample. And if the whole reason they're there is because we think they have a urinary tract infection, like sometimes we can't get an answer because the bladder's empty. So kitties, again, sometimes it's luck of the draw. But for dogs, like don't let them pee when they first walk in, because there's like our clinic, we're in like a little bit of a strip mall, and there's like this column right outside the door. And so there's this one column where every dog pees, right? And everybody kind of like slows down when they walk past it and they let their dog pee. Just walk right past it. Just keep on going. Because if they are shy peers, then they're going to be easier and more willing to urinate if they have a full bladder. And if they just peed, or they're a dog that tends to mark, they're not going to have a lot of urine left. If it's poop issues, try and bring us a fecal sample. It's really helpful. We don't do a lot of fecal testing in hospital. We send it all out just because of the upkeep, and we want it to be done by centrifugation, which means that it's spun, and that helps all the particles sink and the eggs float up the top, and you get a better reading. So we send it all out, but it's a lot easier to be able to send it out the day of the problem and get it back 24 hours later. Now, if the dog is literally peeing out of its butt, right, so it's straight watery poop, I don't expect you to like get a cup and catch it. But when it firms up, you still may want to get a fecal sample just to make sure parasites are not playing a role. And then for skin issues, try not bathe them like the day or a couple of days before you're going to go, just because sometimes you can mask the cause, wash away the bacteria, or remove the crust that we need to see. And same thing goes with ears. Like don't clean them right before and don't medicate them right before, because if we try and get an ear swab and there's a lot of medication in there, that's all we're going to see under the microscope. The other thing to think about is like if the nature of your appointment changes, right? So let's say you have a typical wellness appointment, or your dog's scheduled for a nail trim, and all of a sudden something comes up. Give us a heads up, especially if it's a technician appointment, because bringing your pet in for a tech appointment and then assuming that a doctor's going to be able to take a look at your pet while they're there, it may not happen, but if we try and fit him in, we're throwing off our entire schedule. So that squeeze-in appointment, right, so that tech appointment that then becomes a vomiting or anal gland issue or urinary issue, that now delays everybody who's behind them. And so it just disrupts the flow, and it's not fair to the other clients who scheduled an appointment. If we can't see you, right, if we say we're full and it's really important, express how important it is. Say you need to be seen on an emergency. But again, don't try and do the tech appointment thing just so we can try and fit you in, because it's not fair to everybody. For sedated and surgical procedures, this is the opposite of your urine and poop issues. You want them to pee and poop before they get dropped off. Because a lot of times if their bladders are huge, when we sedate them, we have to express them. So it just makes things a little bit easier for those patients. And along the same lines of like scheduling a tech appointment and then hoping that you can be seen as a doctor appointment, don't bring another pet. Please, please, please don't bring a second pet. Like if you're bringing the pet as emotional support, totally cool. You know, like sometimes we all need a little emotional support. But if you're bringing that second pet because you're like, I could only get this dog in, but both of them are vomiting, or, you know, I didn't realize that Fluffy needed a wellness, so when they scheduled it, and then I said, sure, I'll come in, and then I realized that, you know, Bailey over here also needs a wellness. I figure I'll just bring them both. It's really not fair to the staff or the veterinarians or the appointments behind us, because again, that throws off the entire schedule. And so that puts the veterinarian behind, which gets the people